Okay. Well, welcome, and thank you all for joining me today to talk about the degree offerings that we have here with the Acupuncture in East Asian Medicine Department at Bastyr University. I think there are other people RSVP, so during this time that maybe more people are joining in. But small is okay. That means that I'll get to go through your questions and then help you to find out information that you're looking for. My name is Angela Zeng, and I am an acupuncturist and also the department chair here at Bastyr. I have been with the university for quite some time now. So I started here with the master program in 1996, and so that has been 20-some years. And today, the first thing we're going to talk about is what is the reasons for people to wanting to be an acupuncturist. Oh, so just a heads up. Sometimes I get excited and I talk a little fast, and it is okay if you have any questions that you need clarification. You can unmute yourself and ask the question, okay? So there are various reasons why we have people interested in being an acupuncturist. There are various reasons, and so helping people have the passion of working with patients with their health conditions is definitely a big one. And having some experience in acupuncture, then you would know that not only we can utilize the acupuncture and Chinese herbal medicine to treat diseases, conditions, but also not only the physical aspect of it, but also the psycho-emotional aspect of it. And the other big strength for the medicine is in that preventative care. And, I always have the saying is, if we can spot the issues earlier, the signs and symptoms earlier, and work with that, it's a lot easier to keep the health compared to when the situation is more complicated. Then you will take more time and effort to return us to that healthy state. These days, there are a little more research in terms of what acupuncture has been effective, and this is especially in managing pain. And as you have heard about the opiate crisis, where people are using medications and having issues with that, acupuncture definitely provides another alternative option that work together with the medication, or sometimes that they can lessen or change the type of medication. So that's an area not only for in the clinical treatment arena, but also in the research area as well with acupuncture. Being an acupuncturist, there are more of the growing demand. Depending on the state or the location where you wanted to eventually practice, some areas still not having enough acupuncturists, and there are areas definitely would have more saturated. And so there are different ways that you can also have a very successful practice, and that kind of lead to the second last point there, the practice options and flexibilities, in the way of you can have a different focus in terms of how you want to utilize acupuncture, or the schedule wise. We do have practitioners who wanted to work only 2 days a week and spending the other 4 days with their family or doing other things they want to do, or the different settings in terms of having an acupuncture practice. For example, as a solo practitioner, as a practitioner that work with other practitioner with other licenses, chiropractic license or naturopathic medicine in the integrative setting. And more, we're seeing acupuncturists in the hospital setting, whether it's in the outpatient department or even in the inpatient setting as well. So these are some of the reasons why a person wanted to getting into the field of the acupuncture and Chinese herbal medicine. So here at Bastyr, there are programs. These are the list of programs that we offer. You see that there is a gap. Is the first 4 are what we call as an entry program. That means that once you meet the prerequisite coming in, they are the first three programs are has a slight difference among them, but you will be able to qualify to sit for board exams and then to apply for your license. The last two are options for practitioners who are already as an acupuncturist. They already got their Master of Acupuncture training, for example, and then they wanted to further their education to include, one would be including the Chinese herbal medicine as a practice modality, so then you can come back and get the certificate, or they wanted to add additional training so that they have an entry degree of a doctor. Okay, and so by introducing them here also to tell you that, to achieve, let's say, to achieve a doctorate in acupuncture, there are actually two different paths a person can do. So depending on your situation, that a student enter one program can actually switch to the other, or they decide to lengthen the program and complete a portion of it first before the additional, and that is possible. So it really depends on your situation and your interest, and or which state that you wanted to practice, because also the state to get the license in a particular state would also determine that which program is actually suitable or needed in order to get the licensure. Okay. Questions so far? Is this okay? Is the speed okay? Okay, thank you. So we're going to start with the Master of Acupuncture, and covering some of the words. So you turn a little bit to the side. So for the Master of Acupuncture, this is the entry-level master program, and again, the goal is like for somebody who wanted to practice the acupuncture. The requirement to entry is either a bachelor degree or 135 quarter credits or a 90 semester credit, depends on your previous education. And there is a GPA requirement of 2.75. And in the prerequisite courses that we do ask you to have a grade C in order to meet the prerequisites. This program is a 3-year program, and it lasts 11 quarters. There is not an official break in the program. So every quarter there are classes, including the summer. And as you know that, a student, once they start the clinical training, and when we are seeing patient in the clinic, it actually runs through the year. And so our program actually run 11 quarters straight. The total hours for the program required to graduate is listed there, 2,354.5 hours required. So this is a requirement to be an acupuncturist. And, the program is structured in a way that the materials are introduced, foundational build first, and then we layer additional information during this 3-quarter. So our students are able to provide the acupuncture services safely, and also all the adjunct therapies that comes with learning acupuncture, which includes like cupping, moxa, the needling of the ear, for example, or the scalp. Okay, and so that's the Master of Acupuncture. So just a little bit side note in the way that, like, for example, at Washington State, you can apply and get the license in Washington State with acupuncture only, Master of Acupuncture. You don't need the herb in order to obtain a license. But if you are planning to go to California, for example, then it is required to have herbal training. And that herbal training also need to come from the same school that's approved by California. Okay, and so Bastyr's program, the next program that we're going to talk about, qualifies you to practice at California or to pass your license exam to obtain license. Okay. I look at our program as kind of lay on top of they have like a core, and then there is addition to it. And so the Master of Acupuncture with the Chinese herbal medicine specialization is with the base of what we just see, the Master of Acupuncture. In addition, the students are gonna learn about Chinese herbal medicine. And that curriculum is not added towards the end, like additional years required, but actually starting from the end of the first year, students start to learn herbs. Because learning herbs still take the time to know the herb, how you can utilizing it, and also applying it. And so starting from the first year, the end of first year, each quarter, the number of credits required is higher than the Master of Acupuncture program in order to learn the herbal medicine. And so this program, as you can see, it's 1 quarter longer compared to the Master of Acupuncture, but the starting from the 4th quarter, each quarter, the credit load is higher, so that the total hours required for this one is above 3,000 hours. Okay, and so not only, like I said, not only you know how to utilize acupuncture, but the students are also competent in prescribing herbs, in whether it's in the patent pill format, the granules, like the powder, or the loose herbs, means like you see the twigs, the leaves coming in the bag and cooking it. And so to apply for treating different conditions. So this is the addition of herbal medicine on top of the acupuncture. Okay. The next one is the Doctor of Acupuncture. So the Doctor of Acupuncture is the first, we call it the first professional degree, or you can also see as a professional doctorate degree for those who wanted to practice acupuncture. It's either with or without Chinese herbal medicine, okay? And so the difference of the Doctor of Acupuncture to the Master of Acupuncture is that there are additional 2 quarters of material or the length added to the previous curriculum. So whether it's 11 or the 12 quarter previously, now you add the 2 quarters, so making it a 14-quarter curriculum. In that 2 quarters, the focus of that is we'll take the foundational knowledge and skills further with the goal in collaborative medicine. What does that mean by collaborative medicine? It means that, you know, in a setting where you will be working with or you are working with other practitioners from other modalities, so that we're communicating with someone who may not know Chinese medicine or acupuncture, or thinking about that you're helping your patient to navigate of their health care, collaborating with their medical doctor or the treatments that they're receiving from chiropractor or a PT. How do we fit into that kind of a care team, right? And so that is one of the focus. And in order to do that, there is more of like understanding in the way of the diagnostic studies, and also some skills, additional skills in the acupuncture treatment, and also the self-professional development. And so that is the additional competencies that's included in this Doctor of Acupuncture. This is still an entry level. It is still an entry level. And so that's why from the beginning to the end, it's a 14-quarter. It doesn't mean, because we want our student to be able to still apply for license in any of the states that our program or curriculum meets. So students who chose to do the Doctor of Acupuncture would need to be co-enrolled in one of the master degree, okay? The majority of the curriculum is in the Doctor of Acupuncture, but because some of the state language is still, you need a master degree in order to apply for licensure, right? And so if a student only have a Doctor of Acupuncture, they may not fit that statement of a master degree. And that's why the students are co-enrolled. But what it also means that it provides the flexibility that the students can change. You know, you decide to start with a Doctor of Acupuncture, co-enroll in master, but at the end you're like, you know, I want to practice. I'm so eager to get out there to get my license first. Then you can actually drop the Doctor of Acupuncture and do the master, or vice versa. So there is a built-in a little bit flexibility for that. Okay. The next two, as I mentioned earlier, are for those that you finish with the Master of Acupuncture, you get your license, and you decide to go out there and practice for a little bit, and then it's like at this time, I wanted to have a doctorate degree, and I wanted to have I want more of the experiences working with other practitioners. So how to do that? They can come back for something we call the completion track. And so this is for somebody who actually earns a master's degree from a accredited school, and then decide to do the short completion program, which is 2 quarters long, and to get their doctorate degree. In this case, because you're already licensure, it doesn't really change the license at this time. It's not a requirement to be a doctor of acupuncture to apply for licensure, but it gives you definitely the title for the practitioner who's already practiced, a doctor title. Okay, and also expands knowledge and skill set. A certificate in Chinese herbal medicine. So earlier I mentioned starting with the first, during the first year, starting in the summertime, there are herbal curriculums, right? And so if we take that herbal curriculum out itself, then it becomes a certificate in Chinese herbal medicine. So again, this is for somebody who completed an acupuncture degree, and then now they wanted to add or expand their practice in Chinese herbal medicine. Then they can come back to school to do this, just the certificate portion, but then that may also allow them to be licensed in particular state. So scenarios. One, initially, you wanted to have a lesser credit low and be an acupuncturist first and do just acupuncture, right? And now you wanted to expand your tool bag by including the Chinese herbal medicine. So then you come back and do the certificate. Or because situation in life happens that you're moving to a state, now in order to get licensure, you need the herbal training in order to get the licensure. Then you can actually come back and do the Chinese herbal certificate. So that would allow you to be licensable in some of those states that requires herbs. So itself is a 2-year part-time program for 9 quarters long. And then again, because the entry is the acupuncture, so you would need to have a degree in acupuncture already in order to apply for the certificate program. So in general, in the United States, that acupuncture is the main that gives you licensability, whether it's with or without herbs. But if you wanted to reverse that, if you have only the herbal training, I can tell you, like in states, you're not going to be able to get a licensure with only the herbal training. And so, so that's why our base is the acupuncture. Here are some of the picture of our core faculty. I don't want to block Dr. Wong there. So right here. There we go. We have 8 core faculty member, and then we have a 20+ adjunct faculty. And here are all the core faculty member from the acupuncture department, but we also have other faculty that teaches in our program from the basic science, from nutrition. And so the one advantage I think here is that we have other departments in the multipurpose school, which allow our students have the opportunity to interact and to with other department, whether it's a faculty or the modality or the students. And so in the clinical setting, here that we share our cases together, right? So they may be seeing a naturopathic, I use upstairs because the department is upstairs, and then the patient will come down to the first floor, which is where the acupuncture department is, and then also receiving acupuncture. And so sharing the patient, collaborating with each other is an opportunity in the multipurpose school. Our core faculty member have been with Bastyr for many, many years. You can see actually actually other than Dr. Lumiere, which is this one, that the rest of them are actually my instructor when I first started the school. And so so you can see that, we have 20 plus years, they have 20 plus years teaching at Bastyr. And has been like something that we're really proud of is the tradition, and then how our faculty, the stability of our faculty, knowing what is needed to build that really strong foundation for our student, not only to pass the exam, but also eventually to go out there and practice. And so in addition to these core faculty member, we have other adjunct faculty, whether they're teaching in the classroom setting or in the clinical setting. And each one of them have different focus or specialty area or style. And so as a student, you go through the clinic, you wanted to also experience and learning that, someone maybe focus more on the 5-element acupuncture or the Japanese style, or treating mostly women's conditions, gynecology, women's conditions. And so they are different faculty that give the students the opportunity to specific requests to be on their rotation and to learn from them. And so it's not just with our core, but also has the variety. And even with our adjunct faculty, we have really also many years of experiences in the field and also with Bastyr. And so those are some of the key things. And if you haven't get a chance, you can definitely visit the Bastyr campus, Bastyr clinic, just to take a look of the surrounding. I always said that, when I first started at Bastyr in '96, that I thought, no, I'll get a degree and I will have my practice. And eventually I actually stayed and never left Bastyr. Just it's a place where you can learn, and then it's environment that stimulates and balances. And so those are some of the things. And in the clinical training, there are also opportunity for our students to be in community clinic. And in the community clinic, in addition to Bastyr Center for Natural Health, in the community clinic, you were able to work with different populations of patients. At this time, one of the site we have specifically treats cancer patients, people who diagnosed with cancer and is receiving chemotherapy, for example, and then that they're utilizing acupuncture to help reduce or manage the side effects from their chemo treatments, right? And so that is a very specific population and opportunity for our student to learn from. And then in the Doctor of Acupuncture program, students are able to, if they want to, options to go to Harborview Medical Center, which is a tier 1 of a trauma center that we are in the pain and the anesthesia department. And so at that site, the experiences are with the inpatient patients. So the patients who stay in the hospital receiving the treatments, but have opportunity to get acupuncture as well. So the opportunity to be at the different sites and see that integrative setting is also a plus for the program. Okay, so that's like the key points I wanted to share with you. I'm wondering whether at this time, any questions from you, any things that you were hoping to hear but haven't heard? Yes, go ahead, Xuan. Right?
Angela. Yeah, I'm Xuan. So I have a question. So can you share some of the schedule, like what the schedule gonna be like? Because I'm a mom with a first grader, and if I go to school, so I wanna see what's the life's gonna be, and can I adapt to that? And also, yeah, just cooperate with my husband together.
So before I do that, my email address, how do I share that would be the best so that you get, in the chat. I am going to get the chat. Okay, I just sent you my email address, and so if you have like specific questions, you can You can send it to me as well. I'm gonna answer Xuan your question in a couple ways, and if that also relevant to other people, let me know. I'll try to find a student that who is a mom as well, that mom or dad. I can find mom, and then so that you can get connected and you can ask some specific kind of like how that demand is. Because I think it kind of depends on, like you say, it's a first grader, so it kind of depending on how old the kid is and what kind of supports that you actually have. So a couple of things. One is during it's great that you're actually asking that question early, right? So I would say one, if your prerequisite, you're completed with your prerequisite, my recommendation would be to start looking at some of the basic sciences class, because those can actually lessen your load when you are here. Okay, and that classes include the organic chemistry, biochemistry, microbiology, anatomy, and physiology. So I'm going to type it in the chat. So we have a class called Survey of Organic Chemistry. So that's the first class, anatomy and physiology. There's 1 and 2. Usually, I'll type all of them in first. Microbiology. Okay, so these are 1, 2, 3, 4. Yes, these are the 4 classes that you can take in the community college or at the first 3 years of college, and then get it transferred in, right? And the survey, if you need to triage or priority, I would say get the anatomy and physiology first. And often you will need to complete the whole series from that school in order to have the best transfer. If you only do a components of it, a lot of times that we won't be able to assess to see when you come here whether you need the anatomy physiology 1 or anatomy physiology 2. Okay, so it's best to have the anatomy and physiology and coming in. Microbiology would be another one that you can take. And then the other would be the Survey of Organic Chem and Biochemistry. It's going to be a little bit harder because most of the other school, you would need to take separately organic chem and separately biochem in order to have a combined, in order to transfer in. Okay, so just think about that. It's harder to find one single course that would meet both of that requirement. So you will take 2 courses in order to transfer in. But the result of that would be lessen your credit loads when you are in the program. Okay, so that is during the first year.
Gotcha, thank you. And then the thing is for chemistry, I saw that you have specific saying that it's survey of organic chemistry. It's not the general chemistry, right?
So general chemistry meets a prerequisite requirement. There is a chemistry requirement, right? But if you get an organic chemistry, not a survey, but if you have an organic chem, it will fulfill the half of this class.
Got you.
So you would need an organic chem and biochem in order to meet this class. That's why I said it's not going to be a 1 class transfer in. It's often going to be a split into 2 classes.
Got you. So if we don't have, this is for the prerequisite, or this is something.
This is in the curriculum.
In the curriculum. Oh, got you.
Right.
Okay.
So these 4 classes are in the curriculum. So if you already have your prereqs meet, right? You have your physics, you have your chemistry and all that, you're already done with those. You still have some time, right? Then I would say go ahead and take 1 of these classes or 2 of these classes, because when you are in the program, you will lessen the load when you are in your first year.
Okay, so that online class doesn't work, right? We have to go to physically go to school.
Actually, online, I think does work. Our admission can probably help you with our registrar. If not, you can just say, hey, I found this one, would that work? And then, can have the registrar take a look. Often, or our basic science department, these are our basic sciences courses. Usually it get assessed by the basic science department.
Got you, got you. Thank you. So, what are the prerequisite classes? Can you type to us as well? I'm sorry. So, because these are the classes that for like if we can do these classes previous to the admission, so that will save us a lot of work, right? We don't need to attend when we entered Bastyr to do the study. But the general prerequisite will be chemistry, biology, and psychology, and
Physics.
physics. Okay, got you. Physics.
Those ones that you need before you enter. But if
Oh.
you ended up, let's say, one of your prerequisite, you register in the summertime as your last one to complete, but then, the final exam of that class actually runs into fall quarter. If you have only a little bit like that, that's a little bit behind. I would say still go ahead and apply for it, because if you have only one, that's that is like concurrent you're doing, but won't complete it before the program start, we are okay with that because we know it's going to come in. But if you have more than one, I really don't recommend that, and we usually don't allow that. Part is because I'm going to share with you what the curriculum look like in terms of schedule, and to do additional classes on top of what you already have, it's tough. It's tough.
Yeah, do you recommend us to attend the class? Can we register from Bastyr about like a survey of organic chemistry this class? Or you don't offer that for us to attend before we get admitted?
Oh, I see what you're saying. So if you already have, so you're saying it's like if you completed your prereqs already, right?
Oh, yes.
Okay, if you complete your prereq already, can you actually sign up for the survey of organic and chemistry, biochemistry? We only offer that this quarter in the fall, so there is not an opportunity to do that.
Got you. Okay, but
maybe let me, before I forget, let me share with you what a first year's schedule look like, so you have a visual.
Yes. Thank you.
Where's my share button? Share screen. Okay. It may actually look worse than it is because there are duplicate classes, because this is more on my side as what the schedule look like. And so the first quarter, if you look at just a block itself, you can take away one block here because there are two sections of the lab, right? And so oops, sorry, Control C is what we want. Okay, so if you take away one of this and also take away one of the purple block, then that kind of gives you a sense of what the demand look like, what the hours requirement look like. And so if you have, like we said earlier, if you have the organic chem and biochemistry, then these two blocks are out, right? These 4 hours are going to be out of your schedule. So basically lessen the course demand. And so it is a very much a full-time program. And so to kind of answer another option for you is that, if the hour to you is really still too much to handle, even with taking the chemistry out, the other one I have seen it a little bit more these days is the student come in and say, I want to do a part-time program. Do you offer a part-time program? And our recommendation is that focus the first year on some of the sciences course. So we would take the first year, divide it into 2 years. So you're going to have probably like the foundation class first, right? And then the living anatomy, and then some of the like history of medicine, medical terminology, will have these classes first. And then in the second year, you will add on the meridians and planes, the case discussions, So kind of split the first year into 2 years in order to lessen the load during the first 2 years. Does that make sense? Okay. So another way of looking at it would be, I think I'm gonna share screen one more time that way. Do you all know how to find our catalog?
Actually, no.
I'll show you where to find catalog. So that way, if you need to, you can. So bastyr.edu. And then if you go to under programs, you can do the search, but I go to the program under academic, you will find our catalog. Okay, academic catalog. I'm gonna select this year's catalog 23-24. Okay. And then on their side, we are part of the School of Traditional World Medicine department there. And then I'm gonna do a graduate program without herb and with herbs. Okay, so we're gonna take a look of the one that with herbs. And if I scroll down, have all the different informations, and I'm gonna jump into the courses. And so in the fall quarter, you see is 23 credits, and that's about 26, 23, 4, 5, 4, 5. So that's 26, 25 hours of in-class time. It's because any of the lab classes double, right? And so it's a 25 hours of in-class time. And so if you are able to take away the biochemistry, then that would be 21 hours. And if you decide to split it, then you would have, taking the 23, let's say, and split it. So it's more or less like 11 or 12 hours per fall quarter of first 2 years. So that is one, is to think about splitting the first year. Okay.
Gotcha. So that means for if trying to do part-time, that's possible, right? Just split.
Yeah, mostly is the easiest one is to split the first year.
Okay.
But and sometimes also because what we have also seen is that because the reason for a student to split the first year, in similar to yours, is more of life demand, right? So whether because they're younger kids or family, older parents that they have to take care of. And so, but a lot of times that once you build the foundation, the years after that makes it a little bit easier because out of the class time spent now becomes more focused, right? Instead of a lot of the memorization that you needed to do, it's more of a synthesis in second and third year. So ended up students are able actually to take the load for the second and the third year. And if you still need to extend, we can extend the clinical training portion to make it longer. And so there's a little bit possible like extend for another quarter or two, but I wouldn't say it can extend even further too long because it just doesn't quite fit the schedule how we're gonna break it, like to divide it into 2 years.
Got you. Thank you so much.
You're welcome.
But that also based on we have to finish the prerequisite.
Correct.
And also you highly recommend us to finish what you listed over there. And
right.
Then yeah.
Those ones would be that if you have the time, right? But if you don't, that's okay. And then you can still do it here. But those are just lessen the load options.
Got you. Thank you so much.
You're welcome. Anybody else? Yes.
Hi.
Hello.
Hello. I'm already practicing acupuncture in Japan for over 20 years. Now I would like to expand my career in Washington State. What do I need for me to practice my acupuncture in Washington State?
Okay, and if there isn't anybody that who have already practicing, so can I actually just talk to you separately afterwards with your sister all together? Okay, because there's another option for you. Okay, good. Is there anything else that you wanted to find out, Kathy and Liv? If you have any other questions or and Grace, didn't hear.
Hi.
Hi.
I'm late. I'm sorry for that.
That's okay. I think I'll probably have to answer your questions a little bit later or share with you what the recording.
Oh yeah, that's great. Thank you very much.
Yeah, so just stay on or just send me a message of your email address, and so when I have that when I have the recording ready, I can share it with you.
Thank you.
Any other questions? Okay. Well, if there is no question, thank you so much for spending your time with me. Okay. And again, if you have any of the curriculum or profession questions, definitely you can email me, reach out to me. And if you have more of prerequisite questions or application deadlines and process, the admission would be placed to ask. Yeah. Kathy.
I have a question. Yes, I
Yeah.
have a question. So I saw that maybe 2 screens back you shared like fall, winter, spring, like for the first year.
Uh-huh.
But then I think in my research, the program could potentially start in the summer. So what are the classes that are offered in the summer for the program?
For the acupuncture program, we do not enroll in the summer. We do
Okay.
have right. The summer start is Bastyr has 2 other programs that has a summer start, which is the counseling and midwifery. And so other programs right
Okay.
now for our entry program are all in fall.
Okay, gotcha. Thank you.
Thank you. All right.
I have a question, Chen.
Yeah.
I always wondering about the way how you take the courses. You going to only in person or you can do Zoom online?
Oh, very good question. So our curriculum is all in person. We do not have online classes. And so during the pandemic, we were able to do some of the classes online, but at this time that pandemic waiver has been out. So unless a school specifically wanted to deliver their class online, at this time we do not. We are still assessing the possibility of doing some classes online, but we are not doing it.
Okay. So for a long time, you will keep the classes in person, right?
I'm sorry, for
For a long time, you are going to keep the classes in person.
we are keeping the classes in person, but I'm not sure when because we are in the process of looking at the options of having the online class. And so I cannot promise when that's going to happen. But I can say is our goal is still, even with our accrediting body does not allow any of the hands-on classes or the minimum required clinical hours as a telehealth, right? And so definitely all the program will still have the in-person portions of it. So we are in that process of compare if we're doing anything online, would that be in person, like more of a high flex? So has an option of online or totally online, or what class would that be? I don't really know when that's gonna come out. So I cannot promise like we're gonna have only in person for a really long time.
Right, because the distance is number one difficulty to me to go over, because I do not live in the Seattle area. It's too far to drive every day,
Where are you?
Olympia.
I see. Yeah, I see. Yeah.
It's really difficult.
Right.
So if there's
Yeah, we definitely had a student that come up here during the week and then go back home during the weekend in the past. But again, it really depends on the life situations.
Yeah, that's
Or
too much
drive,
for me. I
actually.
can't handle that because I have
Mhm.
family here. So
Mhm.
that's the reason. If I'm single, I don't care where I am.
Right.
Yeah, that's only my concern because I'm very interested in this program, whatever the Chinese herb or acupuncture.
Mhm.
I always want to take some action on it, but the distance always my number one concern. I hope there
Mhm.
were some, there would some, you
Mhm.
online classes will be much easier for me to take through the
Right.
phone.
Okay. Alrighty. So if the rest of, yes, is
Sorry, I just have a quick question.
sure.
So I'm currently going through a program and I'm almost getting my bachelor's degree in holistic medicine.
Uh-huh.
Uh, but I was wondering if I already have the hours needed and the prerequisites needed, would I need to complete my full bachelor's degree to apply?
Nope, you don't. As long as you have 135 credits.
Thank you so much.
You're welcome. Yeah, 135 quarter credits. So if yours is a semester, then it's 90 semester credit. Okay. All right. So if there isn't, Xuan has one more.
Yeah, I'm sorry. One more question. That reminds me that I got my bachelor degree in China
Uh-huh.
and I got my master degree here. It's not medical directions because
It's
yeah,
okay.
yeah, it's okay. Yeah, but
Yes,
yeah, I need to finish the prerequisite, right?
correct. So
Um,
even if you, yeah, even if you have the, like, any for, like if you have somebody who is doing like a 3 year has 135 credits in like language, right? In addition, you will still need to have those prerequisites done. That
Okay.
so that make them, like 165 before they actually come in.
Yeah, but Bastyr doesn't offer the courses for prerequisites, right? We have to do somewhere else.
I actually have to look and see what is offered right now because we do have basic science department that does offer some classes. I don't remember what those are. It can be in the summertime, so I'm not sure. So I'll have to look and see. So that
Yeah.
would be admission. You can have you you must have the reach out to admission before, so that would be admission question. They can let you know. But if not, I will remember. I'll send it to you.
Oh, thank you so much. Yeah, because I want to know if I can do prerequisite at Bastyr, that will be much easier because when I apply, you will know, okay, what kind of class I do have, and then what other classes I still need to have. Yeah, thank you
Okay.
so much.
Liv,
Yes, I was just wondering if there is a somewhere on the Bastyr page a ability to look up to see if our transfer credits would be approved.
transfer credit will be approved. There, it's so that's gonna be a various steps. So yes, if you go to the what I share with you, the catalog, there's gonna be a section or academic policy in terms of transfer. So that's one kind of look at the overall. And then the other ones would be if you look at the course descriptions. So with our curriculum, if you click on any of the course, it gives you a general course description. So that would be a first way to see, whether your course description from previous would be similar to this one, to get a sense of what that is. To do a transfer evaluation, we usually ask still for your catalog, the course descriptions, and the syllabus, and then it gets sent to the department that will offer the class, and that they would do the assessment of whether it's a transfer or it is a waiver. You also need to be within the 7 years. There are definitely other options that, even though may not be 7 years, or the contents are spread out and it's difficult to assess, there's a way of take a test in order to demonstrate your competency as well. So it's not as simple as like, yes, I can see this course equal to that easy because we don't list all the other possible options from other schools, the courses other school offer. I think,
Okay, that makes sense. Thank you so much for explaining that.
yeah, no problem. Okay. All right. So if the three of you don't have any more questions, I'm gonna answer the questions with because you already practice at Japan, and then that, how do you actually get licensed at Washington State? Okay. So I'm gonna stop recording, or I think that's gonna be more relevant to you. So I'm gonna stop the recording.